Quick reminder, today's session will be recorded. We will have our recording available later on our website. So hey there, everyone, and welcome to our webinar for our Rural Changemaker RFP for 2025. I'm Caitlin Bentley-Thayer, Senior Program Manager of Rural Community Engagement here at Interact. And I'm super excited to have you all here this afternoon. Many of you might be familiar with our RFP from last year, so some of this information might be a little familiar, but I encourage you to stick around because there are some key differences that we've incorporated this year. We'll be having a Q&A session at the end, so please save your questions for then. And with that, we're going to go ahead and get started. Next slide, please. So I'd like to start off by introducing you to some of the folks on our Interact for Health team. You may have worked with some of these folks before, so you might see some familiar faces. Next slide, please. This is our Advancing Health Justice team. You can see here. You can learn more about everyone on our amazing team at interactforhealth.org, and you can navigate to the Who We Are tab up top. So this is Kelly Adcock, our Senior Director of Data and Learning. That's me, Caitlin Bentley-Thayer, Senior Program Manager of Community Engagement for Rural. Sonia Carrico, Program Director for Mental Health Policy. Julian Collins, Senior Program Manager of Community Engagement for Urban and Suburban. Colleen Desmond, Senior Program Data and Learning Manager. Megan Folkerth, Senior Director of Health Policy and Systems. And Ashley Young, Vice President of Policy and Engagement. Next slide, please. So our vision here at Interact is to create a world where we all can live long and healthy lives. We know, though, that there are very real factors that contribute to people in our communities not being able to do this equally. And this is why we work to advance health justice for everyone. Next slide, please. These are the values that help shape our path, and they were a key part in developing how we approach our rural strategy. So we tackle root causes, we amplify community power, we speak openly, we partner with trust, we are relentless problem solvers, and we strive for impact. Next slide, please. This funding opportunity is specifically designed to serve our rural communities. For our purposes, we define rural communities based on population density and available resources. So areas with lower population density that have been historically under-resourced with lower federal and state funding, reduced local investment, and fewer resources compared to urban and suburban counterparts. So this funding opportunity identifies these specific counties within each region and highlights the importance of tailoring efforts to their unique needs. So in Indiana, this is for Dearborn, Franklin, Ripley, Ohio, and Switzerland counties. In Kentucky, this is for Bracken, Gallatin, Grant, and Pendleton counties. And in Ohio, this is for Adams, Brown, Claremont, Clinton, and Highland counties. So all of these counties that are highlighted in green. Next slide, please. So for folks who have worked with Interact for Health before, you probably recognize our priority populations. A lot of people think that you can only serve one of these groups or prioritize only one community in your program. In fact, you can serve many of our priority populations. We know that our communities are not a monolith. For example, There are children and families with low incomes in rural areas. There are Black and Brown communities and LGBTQ plus folks as well. The Rural Changemaker Grant, by design, is meant to dig deep into all of our populations in rural communities and challenge our partners to go beyond just statistics and demographics. Many times, organizations or programs might account for low numbers of engagement with communities represented by our priority populations due to lower population density overall in rural areas, but that doesn't mean that we can't create safe and welcoming environments that meet the needs for all of our communities. Next slide, please. All of this forms a continuum of how we approach our work, as seen here. Our vision is that people in our region are healthy and thriving, regardless of who they are or where they live. Our mission is to ensure people in our region have a just opportunity to live their healthiest lives. And we accomplish all of this through our three primary program areas: community power, policy and systems, and mental health and well-being. Our Rural Changemaker RFP falls specifically under community power, which you see here highlighted in green. Some of the features that we emphasize about this especially are the importance of community voice in projects and programs, as well as the major role our Rural Community Council plays in the selection process. I'm going to go into more detail about the Rural Community Councils here in just a moment. Next slide, please. Here's a bit more information about our philosophy of how we work with our community as a whole and our grantees. We're a flexible catalytic funder. We're a trusted nonpartisan voice for change. We're an independent regional convener, an amplifier of community voice, a go-to resource for data on health and health justice. On that note specifically, when you do see us sharing data and resources, you can always reach out to myself or anyone on our data team to share some of that information. Next slide, please. Now we're going to talk a little bit more about the Rural Changemaker RFP itself. Next slide, please. Next slide, please. We cannot reach health justice without access to the vital conditions for health for everyone in our community. It's about more than having our basic needs met. It's about thriving. And thriving looks different for everyone in every community. What's important is that folks have access to what they need on their terms. That's why we at Interact for Health work towards the goal of health justice. And health justice means that everyone has full and fair opportunity for good health, community conditions, and institutions promoting good health, and no group is exposed to environments that undermine health and well-being. Next slide, please. So we know that when we talk about health, this means more than our physical bodies and wellness, although of course that is important and essential to a long and thriving life. We know that there are many factors that impact health, and in fact, we can't afford to think of this in just an individual sense, and we have to look at it from a broad and holistic and collective lens. Community factors drive as much as 80% of what we call health. When you filter that through historic barriers that marginalized groups encounter, our priority populations encounter racism and discrimination socially and from institutions and have done so for many years. This leads to disparities in health outcomes that we see. Again, this isn't a matter of individual choice or deficiencies. This is a matter of collective concern. and collective action is needed to address it. So this being the case, we've embraced the model of the vital conditions for health and well-being as a method for community-based change efforts, and the vital conditions for health and well-being framework identifies essential factors that enable individuals and communities to thrive. So these conditions are interdependent and collectively shape the opportunities and challenges that people encounter throughout their lives. So they differ from urgent services in that they offer solutions that are typically longer term as opposed to meeting more immediate needs that would be necessary for an individual experiencing a crisis, such as crime response or emergency medical treatment. Next slide, please. So here is an overview of each vital condition, along with some definitions and examples. So the first is a basic need for health and safety. This condition encompasses access to essential resources such as nutritious food, clean water, sanitation, and healthcare services. Ensuring that these basic needs are met is fundamental to maintaining health and preventing disease. An example of this are community programs that provide free health screenings and vaccinations to underserved populations. The next is humane housing, and this refers to safe, stable, and affordable housing that supports well-being of its occupants. Adequate housing conditions are crucial for physical and mental health. An example of this are initiatives that offer affordable housing options to low-income families to prevent homelessness. The next is meaningful work and wealth. This involves access to employment opportunities that provide fair wages, job security, and the ability to accumulate wealth. Meaningful work contributes to a sense of purpose and economic stability. An example of this is job training programs that equip individuals with skills needed for gainful employment in their communities. The next is lifelong learning. This encompasses access to quality education and opportunities for continuous personal and professional development throughout life. Lifelong learning fosters adaptability and personal growth. An example of this are community centers offering adult education classes to enhance literacy and job skills. Another one is reliable transportation. Access to safe, efficient, and affordable transportation options that enable individuals to reach employment, education, healthcare, and other essential services. An example of this are public transit systems that connect underserved neighborhoods to major employment hubs. The next is a thriving natural world, a healthy environment with clean air, water, and green spaces that support the well-being of all living organisms. Environmental health is integral to community health. An example of this are urban parks that provide residents with spaces for recreation and connection to nature. The next is engaging with civic muscle, a sense of inclusion and the capacity to participate in and influence community decisions. This condition emphasizes social cohesion and civic engagement. An example of that is community organizations that encourage resident participation in local governance and decision-making processes. Investing in and improving these vital conditions can lead to equitable and thriving communities where all individuals have the opportunity to reach their full potential. Next slide, please. We strive for a system in which a person's health is no longer determined by who they are or where they live. A first step to getting there is convening our Rural Community Council, which is comprised of 15 individuals who live and work in our rural communities. These folks help review and score our rural changemaker projects and are crucial in the selection process. This RFP isn't focused on a specific issue or challenge. Our rural communities identify that. Those who apply can use their own judgment for the proposed project or operation activities. What we are asking is that each applicant identify one of the 7 vital conditions that their program or project addresses in their community and how they do so. We are also asking applicants about the role of community members in how community members shape and impact the program, and ultimately how the program will impact the community. The goal is to support community voice in efforts where they lead in identifying a specific issue or challenge that they want to address, how it impacts health, and a proposed solution or approach. This funding is focused on the approach and strategies that will be used based on the 7 vital conditions of health. Next slide, please. So many of y'all have applied to us before. So, Interact for Health looks for our grantees to meaningfully engage our priority populations, which are Black, Hispanic, LGBTQ+, children in low-income families, 200% below poverty line, and rural, which based on our data, experience the greatest disparities in health outcomes in our region. So we hear often that demographics are a challenge, and we understand that, which is why there isn't an expectation to meet metrics, which means that there isn't an expectation for y'all to meet a specific number of folks served. We don't expect numbers to be hit. There's an expectation only for you to create an effort to reach out to all communities and create a safe and welcoming space for everyone. We're focusing efforts on funding local solutions to local problems that have a strong emphasis on community voice. We recognize our rural communities have skills and assets already, but may need help in moving projects and outcomes forward by way of some targeted funding. Much like our efforts in 2024, Interact for Health is specifically seeking to provide funding for projects that respond to local needs with local solutions. We're encouraging potential grantees to center rural communities for leadership as the primary recipient of benefits from a project and emphasize the participation of the community. This is why we are emphasizing grassroots efforts, focusing on community-driven and community-led efforts. In identifying one of the vital conditions for health, this does not have to be the sole focus of your project or program. This can be a component, an aspect, or a feature of your project or program, but we are looking for systems level projects though, with broad community-wide impact. Next slide, please. So here are the key details for this funding. The total amount available for the whole year is $600,000, with $300,000 released per cycle. These are project or general operating support grants. The anticipated amount per grant can be between $10,000 and $70,000 max. The anticipated length for projects is between 12 and 18 months. And like last year, we're going to be offering multiple opportunities to apply with applications reviewed in April and in September. So we're releasing funding twice. The goal is to fund at least one project per state per cycle, but that's depending on the availability of funds, however, and the number of applicants and screening process. This number may change. We may have more than one grantee per state, and likewise, we may not have a grantee for a state in a cycle if we have no applicants for that state or based on the determination of our council members. The grant making process is subjective, and this is a competitive grant. Next slide, please. So eligibility criteria. You must be a public or private nonprofit or governmental organization, and you must provide services in at least one rural county from Interact for Health's 20 county service area. Organizations that aren't nonprofits or governmental entities may still seek funding through fiscal sponsorship. So that means a fiscal sponsorship is a relationship that you have with a 501c3 tax-exempt nonprofit organization, they're your sponsor, and a charitable project that does not have tax-exempt status, the sponsored organization. To learn more, you can reach out to me, or you can come see me at my office hours, or you can reach out to another person on staff here at Interact. Next slide, please. Here's a bit more about what we're looking for in projects. We're looking for folks to have goals for the grant period that are clear and feasible and in alignment with our RFP. We're looking for folks that can demonstrate that your organization can achieve the goals outlined in the proposal, in the budget, the timeline, and within your capacity. We're looking for you to focus on an issue or challenge identified by the people who live and work as part of the community. Next slide, please. We're looking for folks to serve at least one of Interact for Health's rural counties. We're looking for folks to authentically engage with community members who are actively helping to shape the project, and that's the aspect of community voice. We're looking for folks to meaningfully engage with our priority populations and to identify at least one of the vital conditions for health that the project addresses. So when we say meaningfully engage, what do we mean by that? If you notice, for example, that you have communities that you would like to work with more, you don't necessarily just simply have to accept that this is a matter of demographics. You can dig deeper and begin some work with outreach. So for example, if you might be a faith-based organization that you would like to do some outreach, what might it look like to host an interfaith summit with different churches and religious congregations in your space? You can get creative with your unique position, with your niche and your space, and go to where the people are. Next slide, please. So now we're going to move on to the RFP and the application process. Next slide, please. Next slide, please. I'm available to field any questions y'all might have in person at these dates and times. So my first date in Ohio has just passed, but I'm going to be in Indiana tomorrow and Kentucky in 2 weeks. All of these stops are at public library branches, and you can ask me any questions you might have about the RFP or any ideas for projects you might have or anything else that's coming up for you. Next slide, please. You can apply for the RFP using our grants portal on our website, which you can see here. You go to the web address there and create a profile on our grants management system, and then go from there. We try to make it a fairly simple process, but understand that navigating tech can be tricky. That's why whenever you might have questions, you can reach out to myself or our Director of Grants Management, Christine Schultz. Next slide, please. Because this will be a rolling opportunity throughout 2025, we have several deadlines for applications, as well as dates for site visits and notification of awards. We expect final payments for final awards being made in December 2025 at the latest. Next slide, please. We know that not everything can be captured in your written document. This is why we follow up with site visits. These visits aren't meant to be intensive sessions where we're grilling you or evaluating you. Our goal is to better understand your organization, your project, and your community. Before selecting projects for funding, our staff will conduct a site visit either virtually or in person with the potential grantee. So this meeting allows us to hear more about the proposed project and ask any questions. Really, what we'd like to know is what you would like for us to know, things that you might want to brag about even. It also gives you a chance to ask us questions too. As you're completing your applications, you're going to see some dates that you can hold. Folks who are selected to move forward in the process, we will be reaching out to you with further instructions and information on next steps. Next slide, please. Okay, and now it is time for questions. I think that we'll go ahead and start with folks who might put some questions in the chat. Either Grace or Carly, would you all mind to maybe check the chat and see if we've got questions in there?
I just checked the chat, Caitlin, and we don't have any questions yet, but feel free to drop them or ask them out loud.
Okay, so I invite anyone who would like to come off of mute, who feels comfortable doing so, please ask any questions that you have.
I do have one question. So at the beginning, you mentioned the LGBTQ being a priority population, and I just want to confirm that this is not a federal funded grant, and those opportunities being pulled away from that population before we apply.
So what I can say is that as a private funder, we are able to maintain our kind of special status with that. However, we also want to address as well that we recognize we do not want to place anyone who receives federal funding at any kind of risk. To clarify further, Ashley, if you're in the room, I kind of want to kick it to you as well, since you've been in on a lot of information on that.
Yeah, no, Kelsey, thank you so much. I think that's an excellent question. And so for our funding, we're an endowed foundation. And so we pull from our endowment each year to give out grant funding in the community. And so we are not impacted. But we know that sometimes answering grant questions and things like that could put folks in a sticky situation right now. And so we are completely flexible in how you all might need to talk about your work given the current climate. And so I would definitely just reach out to Caitlin if you have any concerns or want some advice on how to fill out the application. She'll be able to better assist you. But great question.
Yeah, cool. No worries. We're just applying for a different SAMHSA grant, and we had some great data on that community that needs services, but it doesn't sound like we'll be able to apply with that priority population. So I just wanted to confirm that wouldn't be affected in this grant as well.
Yeah. Great question.
Yeah, that wouldn't be. Yeah, thank you very much for asking that. That wouldn't be something that would be an issue with us, but again, we recognize that with other funding sources that does pose a conflict or may present an issue.
And we do have a few questions in the chat, Caitlin.
Okay, great.
One of them being, since we have two RFPs that recently released, Local Policy and Rural Changemaker, can you apply to both?
I believe so, but
Yes.
that's another one I want clarification from Ashley on, maybe.
Yes, you can apply for both.
All right. Yes, you can.
And another question, could you discuss the role of the community councils or the committees in the RFP process?
Yeah, I'd love to. So our rural community councils consist of 15 individuals from all across our region. Their role essentially is to review and score the projects that come before us. So after folks submit their projects, they go through kind of a rigorous scoring and review process. Our council comes together and then we discuss the projects, and our council has a major role in determining which projects move forward, because we here at Interact for Health do not live in your communities every single day. We do not work in your communities every single day, but our council members do. That's why we've kind of collectively brought folks together to utilize their determination as everyday folks who live and work in your communities, to have their perspective, their expertise, and their on the ground influence in these projects, and having their determination about what projects to advance and move forward that best meet the needs of the community.
And it looks like we have another question. Does the rolling grant process mean that if it's not awarded in the first round, will it be considered in the second?
Last year, we actually did have top scoring projects advance for consideration in the second round, and that is something that we're considering for next year. So that is on the table for this year.
Is there any space for a community engagement session to ask what some of the needs of the council identifies prior to submitting an application?
When it comes to any of the sessions that I have that are my office hours, folks are free to ask pretty much anything. However, we haven't convened our first community councils for the year yet. We are still in the reviewing and vetting process, so it's kind of hard to make any sort of determination. And likewise, you can't necessarily make a determination of what other folks' ultimate collective perspective is going to be, because other folks' perspective is kind of their own. I can only sort of give a broad sort of bird's eye view.
And I'll say, just to clarify too, the council doesn't identify priorities. They're just reviewing the application and the priorities in which you might include in your application. Hopefully that helps. Does that help, Christy? Right.
A bit. I just was kind of seeing if there was an opportunity like to get some engagement a little bit across the board to get feedback. Thank you.
Okay. Now, if you wanted to submit a project that involved better understanding community through engagement, that can be a project that you submit for.
It looks like we have some other questions around the county located. So can a project benefit an area beyond the borders of the county? And would this be a positive or a negative in terms of potential funding?
That is a really great question. So because we are kind of thinking of this in terms of regional impact as well, the way that we're looking at all of these projects, all of this perspective is, as long as you serve at least one county, you can be up for consideration. So you can serve one county, you can serve all of the counties, and then one outlying county. We're trying to make this as approachable of a grant experience as possible for folks.
And then another question on the cycles. If you submit a proposal in cycle 1 and it's not selected, do they need to make any adjustments for it to be considered in cycle 2?
Last year, when it came to submitting and then resubmitting, we did only permit folks to submit one project per cycle.
And then we have some questions around grassroots efforts. Can you expand a little bit more on that?
Thank you for asking. So when it comes to grassroots, the way that we're defining that, are essentially national, regional, international efforts that are people power. So ideas that are generated locally by local people and then kind of expanded on from there. So any sort of people movement generated either organization or idea or movement that has started from the ground and then sort of moved up from there. So whether it is a small organization that was started by a local group of concerned folks that sort of grew from there, or a small coalition of concerned citizens. That is what we mean by a grassroots effort, something that is locally generated by local folks.
Mhm. And I would say the example that was provided in here was like such as engaging the priority populations in planning process and meetings and stuff. And so I would say yes. Caitlin, you agree?
Yes, most definitely.
Do we plan on providing any feedback to non-selected proposals?
Absolutely. That's something that we have done last year and we plan on continue doing that too.
That was the last question I have in the chat for now. Feel free to keep thinking and post any if you have any other questions.
Okay, and I also invite folks to come off of mute too, if you feel comfortable coming off of mute and just asking your question aloud.
We'll drop Caitlin's, there was some questions in the chat about reaching out. You can reach out to Caitlin. So we'll drop her email. Somebody already dropped it. Grace dropped it in the chat.
Thank you, Grace.
There's one other question. Do appointments need to be made in order to speak with you in Grant County?
No, not at all. You can just drop in. Okay. Are there any other final questions, either asked aloud or questions in the chat? Okay. All right, next slide, please. On that note, I want to thank everyone for joining us today. If you have any final questions, please feel free to reach out to me anytime. This is all of my contact information. That is my direct cell phone. Do not hesitate to text me. Do not hesitate to call me. I will get back to you either way. You can leave me a message, like I said, and you can text me. That is my direct email too. You can email me anytime that you need to. Again, thank you all so much for joining us today. I hope to hear from you. I look forward to it. Come and see me in person and have a great rest of your day. Thanks so much for joining us.